Thank you very much. I'm going to be talking on some broader issues, and then I'll focus in on TTIP for a while, and perhaps also pick up in questions a bit more detail in relation to some of the workforce issues as well. Firstly, can I say I'm really pleased to be involved with tonight's event. Certainly we've been working closely with Moseley and Heath Ward Labour Party to establish this event, and you might be somewhat surprised that it's Unite that's engaged in this, partly because you wouldn't possibly necessarily expect Unite to be a union that has a lot of involvement in the health service. When you see things on the telly about the NHS, more often than not, perhaps it's a Unison or an RCN rep that is quoted on those interviews. You may be surprised to know that Unite has 100,000 members in the NHS in a whole range of different areas of specialisms, from speech and language therapists through to community health visitors. The blood service predominantly is Unite membership as well. But it's not just because we've got those members in the health service that it's important that we're involved in this discussion this evening. Unite nationally has 1.2 million members. And those 1.2 million members, to my mind, just like you in this room, are 1.2 million shareholders in the NHS. Now, I'm going to say a few things about private companies and their shareholders a bit later on, but I genuinely use that phrase shareholders because I think, just like everyone in this room, our members have paid their national insurance, they've paid their tax over their working lives, and they have contributed to what is their NHS, the thing that they have created, just like many of you in this room have done over many years. Perhaps a bit unlike HSBC, who have done a good job of hiding people's taxes rather than paying them. But also, potentially, as well as those 1.2 million shareholders, or same as everybody in this room, that is potentially 1.2 million users of the service, because for whatever reason we all rely on the fact that if we step out of this meeting this evening and something happens to us, we know that there will be a blue light that will pick us up and take us to a local hospital if that's the care that we need. And that was absolutely the founding principles that the NHS was based on, that it was free at the point of need. So, along with other trade unions at the very start of the NHS, we were championing the idea and the principle that it should be free at the point of need, and that it was trade unions that were involved, along with the Labour Party, around the creation of the NHS. And we've had a stake in its past, and we hope to have a stake in its future, and this is what the discussion is very much about today in terms of what future for the NHS. I think you'd be genuinely quite staggered to understand that since the Health and Social Care Act came in 2012, just how much of the service that we think of as the NHS has been either put out to tender or is already being run by the private sector. You heard figures about the global total of how much the NHS, in terms of its revenue, is per annum, but already £10 billion worth of services, over £10 billion, has been put out to contract in such a very short period of time, and with little or no public knowledge of that fact. Unite last year commissioned research into those tenders and uncovered the depth of which it has been taking place. Most of the providers that have been involved in those tenders, the most successful ones, have been private sector providers. The NHS has won very little of the contracts that have been put out. So when David Cameron very famously in 2010 said the NHS is safe in our hands, I'm sure there's that many of us in the room that believed him at the time, what he actually meant was the NHS logo, that blue and white logo there that's on the sign that we all associate with the NHS logo is safe in their hands, because you'd be staggered to realise about the number of services now that when you go into an NHS hospital that you think, and it's got the blue and white logo there. They're actually being delivered by Virgin Healthcare, by Nuffield, by a whole host of other organisations, but the logo is fronting that contract. So you think it's the NHS, but actually the provider behind it isn't. And that's something that we're experiencing very much so in some of the fights that we're involved in as Unite within the West Midlands region about some of those contracts that are being put out. Philip Hunt mentioned earlier on about Stoke and North Staffordshire and the cancer and end-of-life contract that's currently out for tender up in that area of the region. This is a £1.2 billion contract over 10 years. And once it's let, it commits the people of Stoke and North Staffordshire to a provider without a break clause. There is an integration period for 2 years, but once that 2 years has gone by, for the next 10 years, they are committed to that provider, whether it's good, bad, or indifferent. There is no break clause on that contract. The process by which it's been put out to tender has been shrouded in secrecy all the way through. Believe it or not, the CCG and the Chief Executive, Andrew Donnell, who's leading this, has said that they've carried out consultation, and their version of consultation is actually sending a letter to GPs. Not one single public meeting has been called by the CCG in the past 7 or 8 months that this tender process has been running. So the people of that area, like you tonight, have not had the opportunity to come to a meeting that's been called by the CCG. Thankfully, the community up there, an organisation called Cancer Not-for-Profit, has been very active in making sure that people know that this proposal is taking place. And they've got over 14,000 signatures on a petition to try and stop this privatisation taking place. There has been a great deal of discussion with the clinicians up there, the local authorities, with the community at large, and overwhelmingly, nobody sees the logic for this service being privatised. At the moment, as it stands, there are 5 private sector companies that have been shortlisted and 2 NHS providers. But nobody seriously thinks that the NHS providers are going to be the ones that win this contract. And I just want you to think for a moment about the service that we're talking about here. This is some of the most vulnerable members in that community, people who are faced with that really traumatic reality that they have got cancer and that there is a limit on their life. The fact that actually out of the care, the cancer treatment that they receive and the palliative care, that profit should be made just seems obscene to me and to most of the people in that community. They think it should be delivered by people who have the patient's interests at heart, not the profit, the shareholders' interests that a private company has no alternative but to serve. So this is going on now as we sit in this hall, and you have to understand that there has been, dramatic activity already in terms of the privatisation. While the badge hasn't changed, the provider has. And this will get worse, not just in terms of what the current government have in their policy toolkit come May the 8th, sadly, if they win the election, but more importantly, some other things that are taking place. There is a discussion going on between the United States and the European Union at the moment about the Transatlantic Trade and Investment Partnership. Very long title, TTIP for short. We know it internally inside Unite as the Transatlantic Trade in Privatisation, because what it is actually about is allowing companies from over the other side of the Atlantic to bid into goods and services, and the services is the key bit, for contracts inside the European Union. Now, in some areas you might say, oh, well, that's okay, that's free trade, that's fair, that should be allowed. But what the government has kept very quiet through this process is the health service, our NHS, is one of those services that had been included in those TTIP negotiations. And what that would mean is that not just the private sector providers and some of the American arms of those private companies that already operate in healthcare in the US that are bidding in now, but it would mean that those healthcare companies from the US not only could directly bid in for those contracts that are happening in the NHS, but if they're not put out to tender, if contracts aren't fairly tendered in the competitive process, then they could sue the British government for failing to do so. So a private company could sue the British taxpayers for not opening our NHS to competition and privatisation across all of the range of services that the NHS offers. Now, we're working really, really hard and lobbying MEPs. We're working hard with supportive MPs and Parliament and community groups and others to make sure that that doesn't happen, and have kicked up a stink about it because those that were involved in the negotiations thought they would get it through on a nod and a wink. Mercifully, people have started to wake up and say that shouldn't happen, and you're now getting a number of people coming out publicly and saying they would oppose the inclusion of the NHS in TTIP. I am conscious of time, but I do just want to focus a bit on two things, really. One, to round off on an anecdote about how that privatisation has had a direct impact on people in this region. But firstly, I want to do say a few words about what's been happening in the workforce issues inside the NHS. The Lansley disaster, as was termed earlier on, has had a major impact. That reshaping and constant churn of reorganisation in the NHS has demoralised the staff. There is no doubt about it. The freeze in pay has clearly added to that. And as you heard yesterday, the culture that has been developing in the NHS, a fear of whistleblowing, the ability to actually flag up when patient care is not what it should be, and for workers to be able to raise that and to have that taken into account and properly dealt with by management, has been squashed. And in most NHS trusts, it's a real issue for whistleblowers as to be taken seriously. But you set that alongside not just those who are directly employed in the NHS and the problems that they feel and the pressure they feel, but there is a burgeoning workforce inside the NHS that is not directly employed, not just those that are privatised. There is a massive growth in agency and locum workers in the NHS because of that restructuring and reorganising that was not well thought through, that has left gaps, and has meant that actually over the past 4 years, a staggering amount, £5.5 billion has been spent on agency and locum workers in the NHS just to cover those gaps that were put there because of fractured reorganisation and a failure to understand what the service really needed. And nowhere is that more apparent than perhaps in this anecdote that I want to round off with. A good colleague who I work with, his son sadly was taken ill, young son was taken ill with a hernia. And in a young child that could be quite a serious issue, and he took him into his local hospital, which was Russell's Hall. But sadly they'd not got the facilities in Russell Hall to be able to carry out that operation. They'd phoned the Children's Hospital here in Birmingham. They got a bed booked and the availability of a bed and a surgeon to carry out the operation ready and waiting. He'd gone in and was in the process of waiting some 4 hours for patient transfer. Patient transfer at that hospital has been privatised, it's outsourced. And in their contract, they cannot deliver to an A&E department. Now, if those of you who have used the Children's Hospital in Birmingham will know that sadly there is no other access point through the Children's Hospital other than the A&E department at the very front. Despite the fact that actually there was a bed booked for this child, so literally they were going to take him through on a trolley, through the A&E, straight through another set of doors and straight onto the ward, the contract stipulated that they could not deliver patients to an A&E facility. The result of that is he'd waited 4 hours. He then had to wait another 3 hours for them to pull a blue light ambulance off service, so taking it off the network of support to those who need it absolutely at the most. You know, blue light ambulance, emergency ambulance had to come off service to take that child from Russell's Hall to the Children's Hospital. Now, if that's not a story of a ridiculous Alice in Wonderland fragmented service inside what we consider to be our NHS, then I don't know what is. And we have got to do something about this. So thanks very much for the opportunity to address you this evening, and I look forward to the debate now.